Hello and happy Sunday. Welcome to the Simply Free Little Talk. Your host, Free Little, is here today on Health Matters, and I have a very special, amazing lady that is in the studio today, and she's going to bring us some great wisdom in regards to depression of the elderly. Miss Nikki Hudson is going to share with you why she was promoted to director of nursing and the years of experience that she has in the nursing industry. Without further ado, let me welcome to Simply Free Little Talk, Nikki Hudson. She is an RN. Hello, Miss Nikki. How are you doing?
I'm good. How are you doing?
I'm good. I'm good. Share with us. You've been in nursing how many years?
22 years of
22
as a
years.
nurse, and I was a CNA for about 3 years, and I was a phlebotomist for 2 years. So kind of always been in the medical field for quite some time.
Wow, that's true. That's a long time. That
Hmm.
is a long
A
time.
long time.
A long time. So with great wisdom though, with great experience comes great wisdom. So today you're here, your topic is depression in the elderly.
Yes, yes. Depression in the elderly.
And what I want to thank you, what I want to say to everyone, recently Miss Nikki has been promoted to director of nursing. So that is her current title. She is an RN, and she's just going to explain some things about the more of her credentials that I did not say. So I want to give you the opportunity to say where you are a nurse as a director of nursing and exactly your credentials.
Well, actually, I am not an RN. I am a licensed vocational nurse, but I
Okay.
am in the process of transitioning for my RN. But I've
Okay.
been in long-term care, which is geriatrics, gerontology, which is the care of the elderly, high-risk
Yes.
pediatrics, wound care, hospice, and I also worked in a hospital setting for about 6 years.
Yes, I recall that. I don't know everybody's credentials, so forgive me
That's
for that.
okay. That's
But
okay.
at the same time, she is very knowledgeable. I have had many conversations with her, numerous
Mhm.
conversations regarding her desire and love for the elderly. So, with that being said, I'm going to just get out of the way and allow her to bring to you this wonderful information that is needed.
Okay. It's set up here. Okay.
Yes, ma'am.
So I have a question. Will I be able to see their questions, if any?
I will be able to look at the
Okay.
questions and say so that you will be able, and I'll read them to you.
Okay. All right. Well, the first thing is that a lot of people don't realize that the elderly, they get depressed, and the normal things or the classic things they think that they would be depressed about is that they're getting old. And
Mm,
that's simply a part of it. Actually, depression in the elderly can actually start before then. You have
okay.
when they have stressful life changes. They have chronic illness, the death of their spouse, having to retire. Watching their children grow up and
Mhm.
go on with their own lives, and they kind of feel put out to pasture, so to speak.
Yes.
And then they feel like, well, you just want to put me in a nursing home and leave me till I die. But that's typically how a lot of our elderly get to a depressive state. It's actually, people think that depression is only feeling sad and crying, and they don't eat, and that's nothing but farthest from the truth. Nothing
Wow.
but farthest from the truth.
Wow. Elaborate on the myths that you just mentioned that
Hmm.
it's kind of a slightly different than what we would normally just assume that
Hmm.
they're, like you said, might be slumped over and the
Right.
outer appearance shows this, but really those are not always
Hmm.
the signs.
Right. Well, the classic symptoms of depression that people would think of would be that they're not eating, they're sad, they're crying, they're kind of like don't want to go outside, they don't want to do anything, they just want to kind of become kind of introverted, and
Hmm.
they withdraw. When actually we have other symptoms, especially in the elderly, they become really, really irritated. Their personality changes. When you would notice that that your great auntie, she would always get up when you come over to the house and always had something for your kids, and now she don't get up. And when she does get up, she's angry. She's irritated. She doesn't want to be bothered by anybody. And they also have a loss of motivation, lack of energy, and they just kind of like laying around a lot. But the most classic symptom is like irritability, and that irritability can often be confused with maybe they have like dementia,
Yeah.
when that's not true. That's why it's important to involve their physician when you see changes that are coming on with our elderly family members.
Wow, wow. That is so informative. And we needed to know this because a
Right.
lot of times, as we talked about previously, you
Hmm.
stated the some of the signs that we assume it may not occur. But I like that you mentioned just a change in that person's normal character, where
Absolutely.
the mood
Absolutely.
swings is one of
Yes,
the signs, the
absolutely.
mood swings.
Um, Yeah, different changes in personality would be that they never used to curse, but they curse now.
Wow.
Or certain foods that they never eat, or beverages that they never drink coffee, but they drink coffee now. Those are all classic symptoms. And in addition to that, they have sleep disturbances. We have this thing that we
Mm,
call sundowners, where they're asleep all day, but when the sun starts to go down, then they get up and they on 10. You can't get them to go back to
mm,
sleep. They're not tired because they've been asleep all day, so they get their days and nights kind of mixed up. And that can cause their irritability too, because they're not resting well as well. So
yeah.
that's another one of the classic symptoms. But a lot of people don't realize too that with depression, um, they can develop pain. You go to the doctor, and your grandma, your great aunt, they're complaining of pain all the time, and the doctor is trying to focus on what's causing them this pain. And they say, well, I just don't feel good. I just don't feel right. I'm not feeling
Yeah.
good. I'm not in my spirit. I've heard it all. When in actuality, the doctors are trying to pinpoint what's making them hurt, when
Mhm.
actually they're depressed. So it's good that, that the family members as well as the residents encourage them to have a really good open relationship with their doctor. And once the doctor gets to know them, it's easier to diagnose. It's easier.
Mm. So basically, some things that we take for granted as well, she complains about her shoulders hurting or her back's hurting. It could be
Absolutely.
actually related to depression.
It can be. Absolutely.
Mm.
Hmm.
Mm.
Absolutely. I knew a woman, she is in her late 50s, and she lost her significant other, and she just developed this uncontrolling shoulder pain that she kept all the time. All the time. She went to the doctor numerous times. Nothing seemed to help her, but it just seems like, she could never, ever get rid of this shoulder pain, and they never could find the source of it. So if you're having some kind of pain, and they x-ray and they do MRI and they do tests and they're negative, but you're still having that pain and it's not a nerve type pain, is typically depression. Yeah, depression
Mm.
is it's kind of it's looked over often when you have people who have complaints of chronic pain. And a lot of people, they misdiagnose them, and they think that, oh, they just want pain pills, they just want medicine.
Mhm.
In actuality, they just really want to feel better, and they don't know how to explain to you what's happening to them, because they don't know what's happening to them. So that's
Wow.
one of the key factors too, is it with depression, is actual physical pain. They have joint pain, generalized pain. They just don't feel well, and it's like all of a sudden, it comes and it goes, and sometimes it becomes a chronic condition for them. It can.
Mm. My Lord. So basically, someone is in pain and they can't explain it. It's in different areas of the parts of the body. And so medical doctors or nurses, examine them and they're still stating, well, there's nothing medically wrong with them.
Hmm.
So would you say that it could be also mentally something because of,
Absolutely.
associated
Absolutely.
with the death of that loved one? Yes. Wow.
Absolutely. Absolutely.
That is
Absolutely.
so impressive, because we don't know. So
Right. That's
you're
true.
really teaching
That's
us
true.
today.
That's true. And they, with the depression, that can have pains. They have headaches and joint pain. Sometimes they can have, like I said, the sleep disturbances, the appetite, the mood swings, and it could get so bad sometimes that they don't recognize um, other
Wow.
people. That depression is just that powerful, especially if it goes untreated, especially in the
Hmm.
elderly.
Especially in the elderly.
Hmm.
So, how crucially important is it for us to really monitor or someone attend the doctor's appointments with our elderly?
Absolutely. I would say if you could go to every appointment, I would say go to every appointment, because something can get missed that the patient isn't telling the doctor that you're aware of. You can't send them to the doctor and say, "Oh, don't forget to tell them that XYZ, you need to be there so you can help give a clear account of what it is that you're seeing." So that would also aid in the patient being diagnosed correctly. And I know people think that with depression, they say, "Hey, take this pill and it'll fix it and it'll go away." Not necessarily. Not necessarily. That's just like if you have high blood pressure. You're probably going to have a couple of meds before the doctor gets the right combination to treat your hypertension. Metoprolol, lisinopril, all those blood pressure medicines, they don't treat everybody the same way. So sometimes a person has to be on more than one medication before the doctor can actually find the actual combination that works. And when you find a combination that works, it usually, we want to say, like anywhere we'll see like maybe from 6 to 8 weeks where we'll
Yes.
see a difference in
I
that.
love that. Well, see, the knowledge that you bring is because of your vocational training, meaning you have been educated in various fields. And that's
Hmm.
why all the years of experience, that really qualifies you. And sometimes, in some cases, overqualify you because you
Thank
have
you.
the knowledge that, yes, I can say it because I work with many nurses and I thank you. It's true. That's why
Hmm.
you're giving us all this information that we are obtaining today
Hmm.
because of your years of experience. And as a vocational nurse, it's just a higher position of knowledge because you have to know. What you're
Hmm.
telling us is it from experience, and then you've actually, it's the case studies. And so I just was
Hmm.
trying to help explain the various educational
Hmm.
levels of a nursing, and you really have that educational side. That's what
Thank
I
you.
love, and that's why you're here on Simply Free Little Talk, so that you can
Thank
explain to
you.
people. So what she's sharing with you guys is not just something she's just pulling out of a textbook. She has hands-on experience, and she's able to provide you that information. um,
Hmm.
because I never knew some of the things that you said of some of the signs that we need to
Yeah.
be more aware of.
Hmm. Hmm.
Wow.
Yeah,
And
because
so,
also,
mhm.
no, I'm sorry, go ahead.
No, I was just going to ask you, and you've seen cases where someone has lost a loved one. Um,
Yes.
kind of go a little bit more because I know that so many people are concerned about that when mother passed, so dad is
Yes.
kind of concerned about him.
Well,
Share some
I,
of the signs
I can actually use a personal experience. My mother, she lost her
first.
husband 2 years ago. And
Um,
everybody that knows me, they know my mom.
mhm.
And they know her to be a very outgoing person. She loved church and she loved to come and go, but they can't tell you the last time they seen her.
Ah,
She just, she lost her best friend.
mm,
And so with that, it comes the depression, and she doesn't leave the house. She doesn't want to go anywhere. And I mean, she's fine. She's
yeah.
fine. She's not the same person that she once was, because she had her job and she had her husband. All of us kids, we were all grown, but that it's a really hard pill to swallow when your life changes and you're forced to accept it. And with that, it's just that's the reality of it. And it can be very, very difficult. It can get so difficult for some people that they're upset because they wake up the next day. I've had patients who, they don't want to wake up. They don't want to face another day of loneliness or remembering the what ifs. And do you remember when? That's not always a positive aspect for some people who like to reminisce on what they did in their form, when they were working or when they were having children. Some people is painful to remember, their youth and what they once had. So it's and depression is more prone in women than it is in men. We
Oh,
see it
wow.
particularly in men. A lot of time, I'm sorry, we see it a lot of more commonly in women, but in
Yes,
men,
yes.
men have the tendency to hide it, even the elderly, because they're taught to be strong and be in the forefront, and they are to be leaders and
Hmm.
not show that vulnerability. And when in actuality you think that they've just gotten really mean, or they start eating a lot, they gain a lot of weight, it's typically is depression. It's typically depression.
So
Yeah.
physical changes is something we need to
Oh,
be more
yeah.
mindful of
Absolutely.
in a person.
Absolutely.
Wow.
They can either go
See, that's
left or
that
right.
wisdom that I knew you had to be on the show to bring forth to us in the elderly, because that's an area that we don't often hear about. We
Right.
talk about
Right.
all uh, specific illnesses, but I
Hmm.
wanted you to come on so that you can explain about the elderly. I know that's your passion, and I love that. I love your knowledge. I love your skill base. So I
Oh,
personally
thank
want to
you.
have you come back on again to
I
share
would
some more
love to.
wisdom nuggets with us
I would
concerning the
absolutely love to.
elderly. You're caring for those that have made a way for yourself and myself to be where we are today. So I commend
Absolutely.
you. I want to say congratulations to you for your recent promotion to director of nursing. I'm so proud of you.
Thank
And
you.
again, I can't sing your praises enough because of the
Thank you.
knowledge you have. I'm very proud of you in that. But let's get to some on a personal note.
Okay.
Your government name.
Oh my
Share
Lord.
with everyone your government name.
Girl, this name. Oh my gosh. My name is, everybody calls me Nikki because I
Yeah,
needed a nickname. So they
she
got
needed a
Nikki,
nickname.
a
I
Nikki
love that.
name. But yes, my name is Nichandra. It's Nichandra Dinette.
I'm not even gonna try to say it.
That's why everybody calls me
We all
Nikki.
say Nikki.
Everybody.
Yes, yes.
Yeah,
But
everybody.
that's good that we know you by Nikki and we love you by Nikki. Everyone knows your beautiful personality. But
Thank
I
you.
wanted them to see the brilliance side of you, the intellectual side that she's packing so much wisdom, guys. I mean, y'all never heard me say I'm gonna have to bring someone back, not because we ran out of time or there's more information, but because of just the wisdom knowledge she's carrying for our
Absolutely.
elderly and
Hmm.
other medical areas, because she shared with us earlier the different various areas that she's worked in. And so
Hmm.
Nikki, thank you for coming on just to share
Thank
with
you.
us depression, because that's an area we overlook. We just
We
think, oh,
do.
that's grandpa, that's grandmother.
We do.
And
We
then I
do.
like you brought out
Yes.
about it's
Yes. And
more
what
prone in females.
Yes, and as we as adult children, we have to realize that the symptoms of depression in the elderly are different in those of a younger person.
Ah,
In a
that's
younger
good.
person, they're more they could be a little bit more vocal, or they're not they're not their normal selves. But
Hmm.
as we grow older, we find that our parents and our grandparents, they're sitting more, or they're
Wow.
not participating more, they're not talking more, they're not eating as they were. All of those things is something that we need to watch out for. See if we can get them up in the morning after they take their meds. Let's take them for a walk or ride in the car.
Yes.
I have a friend
Mm.
on TikTok, and her mother is almost 100 years old, and every single morning
Oh.
she takes her for a ride in her car around the
Mm.
neighborhood. They ride every single day.
Everyone.
You
Yeah.
don't want them to feel as if they're not needed, or they're a piece of furniture, and that they're just simply in
Mm.
the way. And that's not the case. And that's what we all
Wow.
get busy. We all have our lives, but they were the reason that we're here. And so,
Yes,
that being said,
absolutely.
we have to take care of them. Yeah,
Mm.
encourage them to
Wow.
take care of themselves for as long as they can. That will ultimately stop the from them declining so quickly, because we all decline as we get older. But
Mhm.
we don't want to add to the process by ignoring something that's actually there.
Wow. It's really scary that we don't know how to tap in, but you've given us the wisdom nuggets and
Hmm.
even given us
Hmm.
an example of what we can do to help our loved ones.
Yeah.
So taking them out, being more, holding more conversations with them.
Hmm. Hmm.
Man,
Taking
those are
time with them,
wisdom
yeah,
nuggets.
taking time with them, even though they may take a little longer to decide what they want to do or what they want to
Yes.
wear. It's just think that there'll be a time when we won't have to do that for them anymore. So you have to, yeah, we have to spend time with them now, and let them know that, that their time isn't just up. We have
Mhm.
my facility that I work for. I'm the health and wellness director of nurses at Sedalis,
Yes.
and it's not a nursing home, but it's an assisted living. And what we do, we
Nice.
encourage our residents to do as much for themselves as they can here. It's not a nursing home. The only thing they don't do for themselves, they just don't cook for themselves. They get
That's
three
good.
meals and fine dining. Yeah, they get that. But we encourage them to make their own decisions, to make their own beds when they get up. We do their laundry for them and we put it away. But that's the luxury of having assisted living. They're
Yeah.
pretty much independent. We have exercise. I need to share some of the videos with you guys. We exercise and we dance. We have a thing. I think they're gonna call it Funky Friday. Oh, we danced for about
Funky
2 hours.
Friday. We got to interview you on Funky Friday.
We we did the Harlem Shuffle. We did the Watusi. We danced to Elvis. We danced to the Blue Notes. We danced. Oh yeah, it was a good
Ah,
time. It was a good
you
time.
took them
And
back to the era that they're accustomed to, that
absolutely,
their
absolutely,
bodies will automatically move to. I
absolutely.
love
And we
that.
want them that, yeah, we want them to get up and have something to look forward to every single day. That's why
Oh,
activities and participation is so important as they get older, because otherwise they'll just sit. They'll just
oh,
sit. And that's not what you want. Anything that you let sit and don't touch it, what does it do? Mhm.
it'll die.
Doesn't
Yeah.
matter what it is, a plant, an animal, a car, a chair. If it just sits and sits,
Yes.
it deteriorates. It doesn't matter what it is if you don't show
It
it some kind
definitely
of
does.
love.
Yes, ma'am.
Absolutely. Absolutely.
Oh, I'm just again so godly proud of you because you are not only in a position of director of nursing, you're hands on, you're participating, the
Oh yeah.
joy that
Oh
your
yeah.
whole demeanor
Oh
changed, your
yeah.
whole aura just changed once you
Oh
spoke
yeah.
about being with your patients and
Yeah.
dancing and the music you guys are dancing to.
Yeah.
I want to tell people if I had my parents are deceased, of course, at this time, but if I had to bring them into an assisted living, I would want to find a director like yourself. I would want to bring my mother and entrust them with you. Yes,
Absolutely.
because at least I know that when I'm on my 9 to 5 or I decide to take a trip and I place them in this assisted living, I
Mhm.
know that the director of nursing, Nikki, is going to make sure
That's right.
that my
That's
loved one
right.
is cared for.
That's right.
They're having a conversation
I'm
with
the
her.
first one here and
Yes.
the last one to leave every
See?
single day.
Oh
I'm
my
off
God.
today, and as you can see, I'm in my
She's
office
here.
today.
She's there, rather.
I'm in
I
my
love
office
it.
today. Yeah,
Thank you for taking this time with us because I
absolutely.
know you're busy. And that also confirms what I said. You validated what I said. You
Hmm.
were there on your day off working in a
Hmm.
facility
Hmm.
that y'all saw her light up like the Christmas tree.
Yep.
And when she spoke about the love of her patients and how she takes time with them. And I just, again, thank you. I commend you for being that type
Thank
of
you so
leader.
much. It's
That's
a pleasure to be
leadership.
here.
Yeah, it's leadership. Any other wisdom nuggets you want to leave with us? With all the years you have of, nursing, you can tell us so much, but some wisdom nuggets that we can take and make it applicable to our lives when regarding our elderly.
Hmm. Just if you see any kind of change in them whatsoever, pay attention to it. Don't ignore it. Don't
Wow.
ignore any kind of change whatsoever, because I know I go through that myself as the aging process. I'll be 53 years
Mm.
old next week, and I'm
On the
telling
30th, guys.
you, 53 years old next week. And
Yes.
every day, something popping and something is crack a lacking and going on, but you have to
Recollect.
a crack a lack, and I
I
have to
love it.
I have to encourage myself to keep going, because
Yes.
there's a lot of people, I have pains when I walk, but it's a lot of people that they can't walk,
Yes. Talk
so
about that.
with that
Yeah.
being said, yeah, just always pay attention and listen to them, really, really listen to them, and it's okay to ask them, are you okay? Are you really okay? Are you okay? And a lot of times, if it's somebody that they're the closest to, they'll
Mm.
tell you. They'll tell
Yes.
them. Hmm.
So establishing a bond with them or a great rapport like you do with your clients there,
Yeah, absolutely.
that helps them share with you what's causing the depression or what's
Yeah.
lacking.
Yeah.
Yeah.
Yeah. Because
Wow.
my residents, they even know when I'm not feeling good. They'll come
Oh,
into my office one at a time. Are you okay?
that now that is that speaks volumes to your character. That
Yeah.
speaks volumes to what you are implementing and how
Yeah.
people they sense energy. I know
Yeah.
I'm very sensitive in mood swings and
Yeah.
changes in people's demeanors. And so
Yeah.
yes, what you've given us is an alert. You know,
Hmm.
you can see the change and even how they
Right.
verbalize things to you.
Right.
Because if
Right.
they're
Well,
upbeat and
sometimes they
now they're
can't
kind of
tell you.
down.
Yeah, sometimes they
Yeah.
can't tell you, but they're looking for
Mhm.
help. They're trying to ask for help, when they really don't know what's wrong. It's hard to tell somebody
Mhm.
what's wrong when you don't know. And
Yes.
so that's where, yeah, you want to get involved and see, because also with antidepressant medication, psychotherapy helps as well, and a lot of the long-term care facilities or nursing homes, they have
Yes.
therapy. A lot of people just don't know that they're there. They have therapists that are there to see patients. So in combination with the medication, you have therapy, and together they work. It's
Uh,
just not take this pill and it's going to fix it. It takes everybody being involved.
Now, see, that was another wisdom nugget that you just given to
Mhm.
someone who has their family member in a nursing home versus
Yeah,
assisted living. But even at both, you just gave us insight of
they
what's
have therapy
available
available. They
and
do.
we
They have
may
therapy.
overlook. Yes.
Hmm.
So, how important is visits from family members?
Very. Very. We had during the COVID outbreak, when the family members weren't allowed in to see the residents, we had so many people we thought that they weren't going to make it just based on just simply on the isolation and the depression of the disease itself. That they couldn't understand how come their families couldn't come and see them. So we came up with the good idea, the great idea that they could do window visits. So we had
Yes.
get them up, get them into wheelchairs, and let them come to their rooms and open up the blinds so they could talk to them through the glass because they really needed that. They needed
They
that in order
needed
to
that.
thrive. Yeah,
Yeah.
they need
That was
that.
brilliant. Thank you for
Mhm.
that. I know you
A
probably
lot of
saved
work.
someone's
It was a lot
life.
of work.
It was a lot of work, but you saved someone's life
Oh
and you
yeah,
brought
oh
some
yeah,
joy to
absolutely,
them. Yes.
absolutely.
So I know you're very busy. We understand you're even there on your day off. That's
No.
okay. I hope her superiors are listening. Those that know that she has to check in with. She is here doing an interview, speaking about the great things and the great works that you guys are doing at your facility. Please name the facility again,
I
and
will.
because I got some people I need to talk to and
Okay,
tell them, hey, if you need assisted living, you
that's
need to
right.
get with director of nursing. Yes.
Okay.
So
Well,
share with
thank
them
you.
again the name and
I'm sorry.
share with them the name of the facility and
Oh,
then
I'm
what
sorry.
you
Our
guys offer.
facility, it's a community. It is called Sodales Senior Living, and
Yeah.
we have about 30 communities. The one that I'm the director is in Texas City, and it used to be the old Elm Croft over here in Lamar near the College of the Mainland. So if you have a family member that they're still pretty independent and not really nursing home material, or they just refuse to go, but they can't live by themselves, it may be a good accommodation for them. So come by and see us and ask to
Oh,
speak to our tourist and marketing director. His name is
yes.
Scott Palmer.
All right, Mr. Palmer, somebody's gonna come see you.
Yeah, come see us.
Thank you so much for your
All
time
right.
again. But before you wrap it up, give us those nuggets that you give. Just go down the list again. What things like appetite change, mood change?
Yeah, watch. Yeah, for the main key factors in depression in the elderly is that they're really they become withdrawn. Their personality changes, their mood changes, their appetite changes, meaning they could eat less or they could start eating more. Weight loss and weight gain, irritability, sleep pattern disturbances, and that's pretty much the main thing. Unless they just flat out tell you, that I'm depressed. Because if they tell you that they're depressed, then you really, really need to listen. And also the pain that we talked about. They have
Yes, body
so
pain, body aches.
mhm,
Yes.
talk about the pain. Yeah, they're always
I am
hurting.
so grateful for you. I
Hmm.
am. Thank you. You made my day. I feel like I have a lot more knowledge and to be more attentively paying
Hmm.
attention,
Hmm. Yeah,
the signs that you just shared with us, and also
I'm glad. I'm
listen to the
glad.
people when they are willing to talk, right?
Yes, ma'am. Yes,
Thank
ma'am. Pay
you.
attention to them. Yeah, you have to pay attention to them. Yeah, that's true.
Well, you've heard it first right here on Simply Free Little Talk. Nikki Hudson, she's a director of nursing. She's amazing. She has many years of experience, so her knowledge is expanding and she has so much information to provide to you. So if you just want to, can we call you? Can we, you
Absolutely.
said about coming to visit, but just
Sure.
like
Sure.
where
You
you,
can reach me at area code 409-935-6620. Again, that's 409-935-6620.
okay, I'm going to actually put that in the comments for people. It
Okay.
might be after the show, but I
Okay.
thank you. We're going to let you get
Absolutely.
back. Again, thank you so much for coming on Simply
Thank
Free
you for
Little Talk.
having me.
You gave us so much information. Now I know what I need to look for in the elderly, but
Hmm.
also more
Hmm.
importantly, one of the
Hmm.
main things you said that really resonated in my spirit was take time with the elderly,
Hmm.
talk to
Absolutely.
them, see where
Take
they
time.
are.
Absolutely.
Yes.
Absolutely.
Thank you for the wisdom. We appreciate it.
You're
Thanks again.
welcome.
Bye bye,
Thank
love.
y'all.
Man, that was Director of Nursing, Nikki Hudson. Many of you know about Nikki Jackson, but let me tell you what she gave to us is what we all need to be aware of with our loved ones. If we love them, she shared a lot of nuggets. I was just taking kind of some notes there about that we need to be mindful of what they're saying. If they're not speaking, just see the change in their mood swings. It's just so many things, even pains in their bodies. I never heard that pains in your bodies could be a result of a loved one passing that is affecting them, but there's nothing really medically wrong. So take care of your loved ones. This is your host, Simply Free Little Talk. Simply free, Simply Free Little Talk. And I just want to say, please like and share and encourage someone to get on for the replay because what she provided today is valuable information. Again, thank you for logging in and listening to the Simply Free Little Talk. Always remember, share and like.